Welcome to Health Tech Heroes, where we talk to innovators who are rewriting the DNA of healthcare. Today, we are welcoming Raja Danish, CEO at Wise Medical Billing. With over 15 years of experience helping practices recover revenue, reduce denials, and improve cash flow, Raja brings a wealth of knowledge in healthcare management consulting. Raja is passionate about helping healthcare providers focus on patient care by optimizing their operations and revenue cycles. Welcome to Health Tech Heroes, Raja.
Thank you for having me.
I'm thrilled to have you here, Raja. And I think you are the first one from medical billing industry. I'm really curious to hear and learn from you, and I'm so thrilled to have you here. Raja, you have been helping healthcare practices with revenue cycle and billing issues. What made you get into this industry? What made you so keen? Was there any personal experience that you had made you choose this field?
Absolutely. Getting into the healthcare industry and helping physicians and practice owners was really stemmed from my personal and professional experiences. During my early career, while I was working with physicians and practice owners, I realized they're great at patient care. However, they are overwhelmed with the financial part of the practice management, the administrative part of the practice side of things, and hence they were not really able to scale things up. And where I really noticed, like, this is one area, a couple of things that they really need to improve on in order to thrive, in order to grow their practice. And I felt like I can play a vital role to help practice owners get there and achieve their goals and visions. And so it was all about the processes and having the right tools in place where my expertise gets into the flow. And that's how I get aligned myself into this industry. And we started helping healthcare providers there.
Let me ask you, was there a very specific situation, or you said there was a personal experience because of which you made this choice? Can you explain and double click on that personal experience? Tell me, what was that personal experience? Was it some doctor or a nurse practitioner that you saw and you said, like, man, they're so good at their job, but why are they spending time at administrative work? If I can do the administrative work for them, they can have more time to do something they're like experts at. Was there an experience, a personal experience you can share with us?
Sure. As I mentioned, while I was part of a part of a urology group, and back in the years, and I realized the importance of having a physician and a consultant, and the level of care they provide to their patients. And this is the core function and a job of a consultant. At the same time, I noticed where being a practice owner, they wanted to about keep maneuvering around their day-to-day activities on many other tasks to related to the practice, which is always overwhelming when there is no additional staff available. And this is a common challenge for small practices. They start up. They strongly believe like they can easily run their practice with a single hand, but apparently in any business, that's not the case always. Specifically talking about my personal experience, it really comes from my passion towards getting into the healthcare side. And I'll tell you the reason why. One of my biggest goal is helping the community. And I am not a physician or a doctor by myself, but indirectly, I can play a role towards the patient care. If I help physicians grow their practice, that will ultimately leads towards a better patient care. So then I really noticed some of these areas where small practice owners are struggling with, and I decided to get into this profession and take it up from there, provide them due help because I have the experience and exposure. I have all those understanding, knowledge, expertise that I can leverage to help them grow their practice. So that's how I connect my prior working experience with the providers, the practice owners, and that's how, I related towards the broader community.
Was there an incident where you walked into the hospital, for example, because you were sick, or you took a family member, where you saw that the doctors are struggling with administrative work and helping the patients?
It's a great question. Honestly, that there was a moment that really changed my perspective around it. My younger daughter, she's 4 years old now. Once she burned, actually, at the time of her birth, she was going through some complications. I've seen, providers, doctors in NICU working very closely and helping them to get through it and making sure a small kid who is just born really get through things, pretty much survive with the help of those physicians and all that. And considering the initial complications, I went to one of my family physician after some time, and I realized there are many other patients who are waiting to see the doctor. Apparently, being a patient who is coming to any practice, any doctor, they expect great service. They should not be expecting any delays in the consultation with their provider. But generally, if there are lack of processes, lack of administrative staff who can take care of those basic nitty-gritty things, they have to wait until unless they manage their paperwork and many other things. They have to go through it, and that's when I realized how important it is to have a kind of a plan in place, have those practices in place that can help physicians like him. So that's something, that experience really changed my thought and get into a decision, led me get into a decision that helped me started this venture, and we can add value, especially for those practice owners who are struggling with administrative work, and so they can focus. So we help them with all those tasks by managing their operations, their financial, their revenue cycle management, so they can focus primarily on the patient care.
You have worked on various roles, including from S&P Global Market Intelligence to Care Cloud. What made you during that journey to think about medical billing? At what point you found out that this was the biggest pain point that you can address, as Raja Danish has the solution for this? And what was that point? What was that logical clarity that you got?
Okay, it's a great question. First, while I was working for a Fortune 500 organization where I was able to really hone my skills on three major areas: their processes, people, and tools. So these are three major pillars for any business per se, whether it's a startup, in any other industry, and a medical practice itself. That's the foundation where I've developed my skills and leveraged those skills to really, broaden up. And so where I leverage my skills really to expand the business portfolio. So, and while I was working for a healthcare IT organization, where I realized the clear need, where I can see practice owners are spending about 60% of their time on administrative tasks. They are wearing multiple hats. They are a physician who's taking care of the patients. They are managing the financials part. They have to look into the operation side of things. They have to do the hiring part of it as well. And that's where I realize uh, I can play a role and help practice owners to focus more on their core responsibility, which is the patient care. And I know how to run the operation side of things. I know how to manage their revenue cycle side of things. So that's where I decided to really get into it and started off this venture, started off with Wise Medical Billing, where we help physicians to manage the revenue cycle part overall, so they can not only manage their practice well, but they grow their practice at the same time.
You make a great point there, Raja. Essentially, it's not just that what you have, you manage it well, but also it allows the physicians to actually grow their practice too. So that's a remarkable shift and mind change for people who are owning this business, or are the people, the frontline workers who are struggling to manage the administrative work. Now they can actually grow and do more for the patients, grow their business and reach out to more patients just because you're taking care of a significant part. How is it going to impact me as a practitioner?
This is a great question. And this question is just not coming up from your end. I think you speak really at the heart out of many other practice owners and practitioners who are in the industry. They the big one of the biggest challenge is they rely on outdated practices. What it essentially means is, in today's world, in today's digital world, I would say they really need to get on the toes and make sure they get aligned themselves and make sure they are well versed with today's technology. I can see there are practice owners who are still doing the charting on the on they're writing down their notes, and I can see there are providers who are managing their billing operations with the super bill. They're using the face sheets, handwritten face sheets. And that's where that gives us an impression, really, they're not well versed with the technology where they can leverage multiple tools which are already, available in the market. However, how we help them, understandably, because this is that's really an era of transition towards the digital side of it. US healthcare really want all the practices and all the hospitals making sure they're keeping themselves aligned with the latest technologies because of the data security, compliance issues, and all. So this is imperative. This is very, very important for them to adhere to such laws and practices. Now, coming back to the point, and undoubtedly, somebody who is using paperwork, we get into the picture, we help them align some of those compliance related protocols. So we help them digitize their paperwork into their digital tools. For example, somebody who is using Superbiz, the face sheets, just to record their uh, uh, patient-related procedures and diagnoses. So what we do is we really take things up, line things into their EHR system and the practice management system. So they are, well onboarded in today's digital era, and they adhere to the compliance side of it. So that's how we help them um, to manage their charting, their electronic health records in an appropriate manner. That's how we sync up, we partner up with the practices and really help them scale and thrive.
So this brings me to the next question. I believe you have helped a primary care group recover $1.5 million and also an oncology practice increase their collections by 40%. Could you share those specific stories or that specific story? And also, can you share the experience of your customer? Well, what did the customers come back and tell you?
Sure thing. See, I mean, before I get into the actual scenario, I really wanted to take a moment and explain the revenue cycle management. What are the core steps that are really, really important to make sure these are well positioned? So if not, that will lead to problems related to the cash flows, the revenue burnout, and all that. So this journey really starts from patient appointment and registration. For example, a patient comes to see their provider. It is the front desk job is to make sure they set up the appointment, and that's just not the appointment setting. It's about collecting their demographics as well as insurance benefits. If that part is not done right, that will eventually leads towards claim denials at the end of the day from the parent. That essentially means if claim got denied and if it is not recoverable or there are no proper follow-ups to recover such claims, that means you're keep leaving money on the table and not in your bank account. That's one core. That's the fundamental. That's the very first step. Then once you see the patient, then it comes towards your medical coding practice. Your diagnosis codes, your procedure codes has to be properly aligned as per medical necessity there. And if it is not done right, it will lead towards a denial again. Similarly, as the coding part is done, then a biller roles come into the picture. That's then the biller responsibility is to make sure they align the claim, utilize the right modifiers, making sure eligibility checks are in place, and then they submit that claim to the payer side. Then the payer reviews that claim, making sure everything is appropriate. If not, if any one part is missing, that will eventually leads to a claim denial. And when one, as I mentioned, once claim is denied, it means you're losing revenue, you're losing money for all those efforts that you have put in, and that's not there. Similarly, one step before that is also the prior authorization. There are some procedures you really need prior authorization before treating that patient for particular procedure there. So if this is a very common denial, and considering a fact where right authorization is never obtained, that means this is something not recoverable when post authorization is not available in such scenario. So it is very much important to make sure this step is done right in the beginning. So the patient registration, the medical coding part, demographics, prior authorization, the biller's part, I've explained a bit as well. Then payer review the claim, they adjudicate it, and either they accept the claim or they deny it. If they deny it, they mention the reason because of XYZ reason it got denied. If it is accepted, that means all good. If it is denied, again, if it is recoverable, there are many denials which are recoverable. Some practices really do not focus a lot on it, but as a specialized billing company, you have right practices and protocols where you can go back to the payer and try to fix those claims and you get the reimbursement. Though you got the reimbursement with delays, but eventually you get it. Then making sure whatever reimbursements you have received against those claims from the payer end, those are posted accordingly, and eventually that's reconciled with the payments received in your bank versus what your system is telling you all about it. So that's the whole process in a nutshell at a high level that really explains the complete revenue cycle part of it. So now coming back to your question that you touched base about a primary care physician who we were able to recover about $1.5 million for that practice. What was the reason this practice was losing money? They have huge patient base. The real problem was claims were submitted. However, they do not have enough resources in-house who were able to follow up on their claims. There were aged claims sitting there, never followed up, they were denied. So there's money on the table. So generally our protocol is to really have a deep dive, understand what is the root cause of it. And so we just not fix the symptom, but we fix the actual cause of it. So we prevent it happening in the future. So that's how what we did actually. We done the complete audit. We get to know this is a lot of money which is standing there, and aligned our team to have recovered those claims, follow up with them, fix the denials, fix the coding related concerns and issues. If there are demographic related concerns highlighted by the payers, we fixed those areas as well. So within about 3 months time periods, we were really able to recover this much revenue for this practice. So that's how we were able to bring value for this practice there itself. And talking about the oncology part, I think it's a very interesting story there. It's there are multiple specialties. Every specialty have their own coding system, their own specifics that they have to be mindful about. And if your billing team is not really, and the coding team is not really synced and aligned, that essentially, leaves you with some of the concerns related to the revenue loss. So, for example, in this particular case, they were seeing the patients. However, in most of the cases, they were not verifying the patient health benefits. For example, if patient do not have coverage for XYZ procedure, then payer will not pay you for that procedure. Oncology procedures are high ticket items in some of the cases, and it is very much important for any practice owner who is spending time, energy with the patient at the end of the day. If it's not getting reimbursed, then it's a real problem to be fixed. So we get into the picture, we were able to diagnose where the issue is, and we were able to streamline their process. What essentially we did was really streamlining the basic protocols and the processes from the front desk, the coding team, and the billing team, and we aligned those processes. Eventually, they start getting into an arena where things are streamlined. Their claims started getting paid on time. They get out of those cash flow problems. So that's how we were really able to help the oncology practice there. It really leads me to one other situation. Recent past, we onboarded one of the urology group. I think this is important to understand there. They were struggling with huge AR. This was a Texas-based practice, and they were really struggling with the huge AR accounts receivable problems. They had an in-house billing team who, and considering the size of the practice, they need more resources because once you have the more resources, you can easily cope up with the things. However, they were not able to follow up on the aged claims, the claims who were pending at the payer end since more than a year even. That was a real bottleneck. And especially in this particular scenario, we were not able to recover the old claims, but once we streamlined their processes, there was significant, I would say, there was 45% in their revenue within 3 to 4 months time period. And once in the 6 months, practice was fully established, properly aligned, and I can see, and when we were comparing the results quarter over quarter and year over year, and we have seen a gradual increase in the revenues.
So let me ask you this from either of these practices, right? So you had the primary care, you showed there was a huge success with the primary care, with the oncology practice and the urology practice. Any of the CEOs and CMOs came by and gave you a hug? It was a great achievement. These are like big wins, increasing their revenue by within 3 months. You have like such a substantial improvement in the revenue. How did they react to it?
Interesting question and very important question, I would say. And the answer is check my Google profile of Wise Medical Billing, and you can see some of glorious reviews coming up from those practice owners. They speak about it themselves. For your audience, I really wanted to take a moment to explain the urology practice I was referring to. It was a solo practice. We partnered up with them to manage their complete revenue cycle. Almost around 9 months, they added another provider. Now they're multi-provider practice. And this is the time today when I'm speaking, they are really planning to go for a multi-specialty as a group. So they're pretty much streamlined, aligning things, and really planning to go and arrive in the market. So that's one side of it. So of course, practice owners love it because the way we work with them is just not as a service provider. We work in partnership with them. We work very closely the way it's their team, and we have a very close coordination and communication with them. Once you provide that level of service and kind of a cohesion between the provider office and the billing team, that's how things start working well. And of course, their mental ease is much more important, and of course they'll feel satisfied and happy with the outcome at the end of the day.
My next question is you have been in this industry for 15 years. How do you see this technology changing your industry? What advice would you give to people who are in this industry?
First of all, I'll address the entrepreneurial side of it, and then I'll come to the practice owner side of it. Being an entrepreneur, it is highly important. You have to be subject matter expert. It's just not about high level management and the leadership things, and you can really solve the core problems. That's good to that's important and good to have it. So managing practice operations overall, it requires lots of dedication, lots of subject matter expertise, so who understand the core of it. So if you really wanted to get started with this business, you have to understand how you can add value towards your clients, means the practice owners, and how you can do it, making sure you have the right team and right systems in place. So uh, and technology plays a very important role there. Day uh, responsibility now. I'll call it responsibility because we have to live with it. It's our lifestyle. So and making sure you have the right tools in place, and those tools are as per the requirements of the business, and you have those processes in place that are serving your clients at a highest level. That's how you make the difference. So considering that, artificial intelligence plays a very vital role. I mean, in healthcare, which is highly regulated, niche, highly regulated sector, it requires lots of compliance things. So artificial intelligence can help you streamline some of those processes which are purely manual and may not really require human intervention. So if you start adopting it today, you're already in the game. So that's important. So along with the other tools and technologies, this is one of the very important area. Any entrepreneur who is starting off with this business should be mindful about it, should adhere to it. That's number one. Now, coming towards the practice owners, who they are, I can sense because I'm working with them since a while now. I see, they some of them lack the tech savviness. That essentially means either they're hesitant in adopting the technology, the latest technologies, or because they were never used to it. So it is highly important, to learn and understand those practices. I think it is not important to learn and do it by yourself. At a high level, it is important for any practice owner to understand such technologies and how we can leverage, those technologies to make a leap there. So they can automate some of their front desk operations. This will help you better serve your customers, mean patients. The same, some of these technologies can be implemented running your core operations, and you optimize your operations in a better way. So technology is just not only help you solve some of the talent related problems, but also help you fast track your business operations. So in a nutshell, this is highly important for any practice owners to adopt it and have the right people who can implement these strategies and get something good out of it. So that is important for any practice owner to really delve into it and get the results.
Thank you very much. I think your message is very clear. For entrepreneurs, be a subject matter expert, especially in healthcare area. And for the healthcare practitioners, get a high level view on what tools are available out there, find the right partner.
So, it is important to address it and then manage your operations in a proactive manner instead of, being reactive. So once you're reactive and you fix things once error has happened, then lots of complications gets arise automatically. When there's a proactive approach, we strongly believe it because of, my corporate exposure. That's what I learned being part of the corporate. And the the proactive approach helps you not only streamline your operations but really preventing all those issues that are expected. So clear strategies is highly and very, very important, to just making sure, especially for those practices which are really planning to, scale up. So that's very, very important point. Just thought to, add this point there.
No, it was a very good point that you added, and it's not just a tactical thing. You go there and crunch the numbers and tell them that, hey, these are the errors. I'll fix it for you.
And Pasa,
And
I mean,
goodbye.
one
Yeah.
of the yeah, and it reminds me one of the point. I think one of the core point I did not touch base in our previous conversation, and that is two major areas. One, when you have okay, two major areas. One, when you do not have, see, I mean, in order to manage any operations, okay, so the two major areas. One, when there's a operations of one complete department, right? So when you run a department, you need a manager there who can strategize things, who can plan things well. So being a practice owner, do you really think just a biller can do all these tasks? And the answer is no. So where you really need help from subject matter experts who can just not, manage just the billing part of it, but really help you strategize it and, and they act as your manager to make sure your department is properly aligned and that's being driven with a proper best practices and giving you appropriate results. Now, and second point really relates to the results is this is one of the major gap I've noticed, and this is related to business analytics, performance analytics, your practice analytics. What I really mean is when being a practice owner, if you do not have clear understanding about how your practice is performing, that essentially means you do not have any visibility around how you are performing. So in order to make that happen, you need some data. You need just not the data, but you need to really see how this data aligns with the industry level KPIs. And KPIs are essential part of any business. So you can track your performance, you can track your front desk performance, you can track your coding team performance, you can track your billing team performance. And so this is one of the area I think it is highly important for any business owner, any practice owner to really have a deep dive, have sessions with your billing team to understand how my practice is performing against KPIs. If you're doing it, excellent. I mean, that's exactly what you should be doing. If not, uh, now it's the time to really look into it uh, audit your operations, billing operations, revenue cycle management as an overall, and see where are the gaps and whether you're meeting industry level expectations. There is MGMA standard KPIs that really talks about, for example, what is an acceptable denial rate. I'll give you just a couple of examples there. For example, your denial rate should be really less than 5%. If it is less than 5%, it means your practice is great. If it is less than 2%, it means you're thriving. Your billing team is really, really good at it. Similarly, what is your first pass resolution rate? This is another very interesting KPI that speaks about whether your claims are getting submitted properly and get paid in first hand without any rejections, without any denials. So industry practice, industry standard says your first pass resolution should be 80% and above. That means your billing team is super efficient. They are following those protocols, processes, and SOPs. That's the only way you can hit these KPIs and these benchmarks. And there are a few others, but really the point is with your practice analytics and reporting mechanism, you should have absolute clarity how you're performing. If there are gaps, you need to fix those.
Wonderful. Yeah, this is strictly the financial KPI. Then for a clinical practice, there is going to be a clinical KPI, I would imagine. And they probably do have those in place, but they do not have this typically. How many businesses do you think they don't have proper financial or the claims KPI in place out of what percentage
Honestly
do you think?
speaking, this is important question to be addressed, I would say, because this is a major gap. I mean, if you notice, there are many service providers in this industry and many tool providers, practice management tool providers, who do have reports in place. And however, the data is pretty much scattered. A practice manager, I can see practice managers are looking forward, looking towards getting into those reports, identify how their practice is performing. However, they end up getting, you know, uh, kind of confusions in their mind. Why? Because they're unable to see a consolidated, complete picture, which is a summary of your overall KPIs backed by the complete data. So they're unable to find it. So I would say the practices I have interacted with at the time of initial conversations with them, we can clearly see they have the generic reports for sure. However, they do not have absolute clarity on all the KPIs, which are highly important to run their practice. So really, about 60 to 65%, okay, really 65% of the population I've witnessed, they are not tracking these KPIs actively. That essentially means they do not have clarity how they're heading, and towards and how they are, what are the areas to be fixed to really grow further to scale their practice. And this is one of the major concern. I mean, I'm emphasizing on it because this is one area I see requires lots of improvement for any, billing company or service provider, as well as practice owners to see the importance of it and get into it.
Among all the services that you provide, these are all equally important. But establishing a KPI went under my radar. But thank you very much for bringing that up. That alone could be a spin-off, just establishing KPI for other for the practices. And you're saying about 65% of the practices do not have proper KPIs, and that's a remarkable number.
Yeah,
So,
especially small and medium-sized practices. I mean, they
okay,
really struggle in this area.
okay. So, if nothing else, get your KPIs first, know exactly where you stand with the industries, then go for the solutions and then see where you can improve. At
Absolutely.
minimum, yeah.
Absolutely.
So, as a final question, and I'm truly going to give you 90 seconds this time. Why this? Why do we need your service? Why do we need it now?
See, I mean, this is very important for you to really, first of all, really understand how much money is on the table that shouldn't be there. If you really want it to be among 2% of the practice owners, it is very, very important for you to understand how and where you're losing money. As you know, there's some money on the table. Apparently, this should be in your bank, and it is very important now to take action and understand what are those leakages.
Wonderful.